My name is Antonia Villarruel, and I'm Professor and Margaret Bond Simon Dean here at the University of Pennsylvania School of Nursing. The article I wrote with my colleague Richard James is entitled Preventing the Spread of Misinformation, a Role for All Nurses. This article is a follow-up to a prospectus paper that we did for the National Academies of Medicine entitled Identifying Credible Sources of Health Information in Social Media, Principles and Attributes. I was part of the advisory board that was charged with identifying sources of information for consideration by social media platforms to guide them in decisions to promote access to high-quality information. The article by Richard James and myself builds on these principles to guide nurses in identifying credible sources of misinformation and helping the patients and families that we work with make decisions about credible sources so they can make informed health decisions. In the article, we provide guidelines in how to identify credible information and how to work with families in assessing their sources of information and helping them distill credible information from misinformation. I have 4 takeaways. The first thing is that nurses should use our role as the most trusted profession to help patients and families wade through the massive information available from a variety of sources to help them make informed health choices. Secondly, nurses must ensure patients have access to credible information which is consistent with the best scientific evidence available at the time. Third, nurses should use the skills in building trust and empathy to understand the patient's trusted sources of information regarding specific topics, to provide credible sources of information and why you believe them to be trusted, and being non-judgmental in approaches to the interchanges that you have. And then finally, nurses should use the platforms they have outside of their practice settings with families, schools, churches to help clarify misinformation and to provide credible sources of information.